Hello everyone. Today we'll discuss diuretics by Professor Sabashek. So now first we'll see what do you mean by diuretics. So diuretics is an agent which increases the urine and solute excretion from the body. So in a simple term we can say diuretics are the drug which increases the flow of urine from the body. Now we'll see the classification. So broadly, diuretics are classified into three main categories. So first one is a high efficacy diuretic, second one is a moderate efficacy diuretic, and third one is a low efficacy diuretic. So high efficacy diuretic, for example, furosemide. Then moderate efficacy diuretic, we have thiazide diuretic. So this thiazide diuretic again have sub classification like benzothiazines and thiazide related drugs. And low efficacy, the third one is a low efficacy diuretics. These low efficacy diuretics are further divided into or further classified into potassium sparing diuretics, carbonic anhydrous inhibitors, osmotic diuretics, and methyl xanthines. So now we'll see each drug one by one in detail. So first one is a high efficacy, or it is also called as a high ceiling or loop diuretic. So loop diuretic basically act on the ascending limb of loop of Henle. That's why it is called as a loop diuretics. They are highly efficacious as diuretics. Furosemide is most commonly used loop diuretic. Furosemide is a sulfonamide derivative and it is a very powerful diuretic. That's why it is called as a high efficacy diuretic. Now we'll see mechanism of action of loop diuretic. So loop diuretic basically block the sodium potassium 2 chloride symporter in the thick ascending limb of loop of Henle. So this is the loop of Henle. Here the symporter is present, sodium potassium 2 chloride. So our drug, which is nothing but the loop diuretic, it will inhibit this sodium, or it will basically inhibit or it will block the sodium potassium 2 chloride symporter and thereby inhibit sodium and chloride reabsorption. So what happens here, when there is no reabsorption, the sodium and chloride it will be available in the lumen. So whenever there is a sodium, it will lead to the reabsorption of water. So the urine which is present in the lumen is more diluted and ultimately it will increase the flow of urine from the body. So loop diuretic are rapidly absorbed and it is eliminated by kidney. The adverse effects of loop diuretics include hypokalemia, that is nothing but low potassium, and metabolic alkalosis due to the loss of H plus ion. Then hyponatremia, low potassium level in the body. As we all aware of, this diuretic, what it will do, it will increase the flow of urine from the body. So whenever there is a increased flow of urine from the body or excretion of urine from the body, it will also reduce the level of we can say the important ions. Then hyperuricemia, so increases the uric acid level in the blood, may precipitate acute attacks of gout. Then hypocalcemia and hypomagnesemia. Ototoxicities, loop diuretic cause hearing loss by toxic effect on the hair cell in the inner ear. Hyperglycemia and hyperlipidemia are mild in therapeutic doses. GI disturbances like nausea, vomiting and diarrhea are very common. And allergic reaction like skin rashes are common with the sulfonamide derivatives. Now we'll see the uses of loop diuretics. So first use is edema. So loop diuretics are highly effective for the relief of edema of all origin like cardiac, hepatic or renal edema. Loop diuretic is also used in chronic congestive cardiac failure. It reduces the venous and pulmonary congestion. Acute pulmonary edema is quickly relieved by intravenous dose of loop diuretic. Cerebral edema, forced diuresis. So basically this loop diuretic, most of the time it is used in case of a poisoning. So in poisoning due to the drug like barbiturate and salicylate, furosemide is used with the IV fluids. And it is also used in the treatment of hypertension. This particular loop diuretic, it is also used in hypercalcemia and hyperkalemia. So whenever there is an increase, we can say the concentration of calcium and potassium in our body, so loop diuretics are used in order to eliminate this iron from the body. Now next is a moderate efficacy diuretic. It include benzothiazide and thiazide diuretics or thiazide related agents. Now we'll see the mechanism of action of thiazide diuretics. So this group of drug block sodium chloride symporter in early distal tubule. So it is basically act in the early distal tubule. So this is the distal tubular cell. Here the sodium chloride symporter is present. The meaning of symporter means that sodium and chloride both will move in the same direction. So the drug, that is nothing but thiazide diuretic, it will block this sodium chloride symporter and thereby it will lead to the excretion of sodium. So whenever there is a increased excretion of sodium, it will also lead to the increased excretion of water also. Now we'll see the pharmacokinetics. So thiazide are well absorbed orally and are rapidly acting. Duration varies from 6 to 48 hours and they are excreted by kidney. Now we'll see the adverse effect of thiazide diuretic. So all the side effect that we have seen in loop diuretic, same side effect we seen in thiazide diuretic also. That means the low level of all the ions in the body. Hyperglycemia induced by thiazide may precipitate diabetes mellitus, probably by inhibition of insulin secretion, and it is more common when long-acting thiazide are used for a long time. So basically we can see here that thiazide diuretic we cannot give to the diabetic patient because it will precipitate the diabetes by inhibiting the insulin secretion. Weakness, fatigue, anorexia, gastrointestinal disturbances and allergic reaction like rashes and photosensitivity can seen in thiazide diuretics. Now we'll see the uses of thiazide diuretics. So it include hypertension, congestive cardiac failure and edema. Now the last one is the low efficacy diuretics. So it include potassium sparing diuretic, carbonic anhydrous inhibitor, osmotic diuretic and methyl xanthine. So first we'll see potassium sparing diuretics. For example, spironolactone. So you can see here this potassium sparing diuretic, what it will do? It will inhibit aldosterone. So spironolactone antagonizes the action of aldosterone and thereby it will show the diuretic effect. This potassium sparing diuretic also inhibit directly the sodium channel and ultimately it will block the reabsorption of sodium and shows the, we can say, the diuretic action. So amiloride and triamterene, these are the two drugs which directly inhibit the sodium channel. So when it inhibits the sodium channel, the sodium is not reabsorbed, it will remain in the lumen. So whenever there is a sodium, it will attract water. So sodium along with the water increase the, dilute the urine and increase the excretion of urine from the body. Now pharmacokinetics. So spironolactone has a slower onset of action. Spironolactone is completely absorbed orally. Now uses of potassium sparing diuretic. So with thiazide and loop diuretic to prevent the potassium loss, because this potassium sparing diuretic basically it will spare the potassium ion. So whenever we required potassium, or whenever we need a potassium to be retained in the body, then in such case with other diuretic we give this potassium sparing diuretic. Another use is it is used in the treatment of edema. It is also used in hypertension, and primary or secondary aldosteronism spironolactone is used. Now the next class of drug is carbonic anhydrous inhibitor. So basically carbonic anhydrous is an enzyme that catalyzes the formation of carbonic acid. You can see here this is the carbonic acid. Carbon dioxide combined with water in the presence of carbonic anhydrous form carbonic acid, which spontaneously ionize into H plus ion and HCO3, that is bicarbonate. So this bicarbonate combined with the sodium and it is basically reabsorbed. So what happens, this carbonic anhydrous inhibitor, what it will do, it will inhibit the carbonic anhydrous enzyme. So ultimately it will inhibit or interfere with the reabsorption of sodium bicarbonate and causes the diuresis. Now next is the ADR of carbonic anhydrous inhibitor. So metabolic acidosis due to bicarbonate loss. Renal stone, calcium is lost with a bicarbonate resulting in hypercalciuria, and this excess calcium may precipitate resulting in the formation of renal stone. So one of the, we can see the disadvantage of using this carbonic anhydrous inhibitor, that it will lead to the formation of renal stone. Hypokalemia, drowsiness and allergic reactions can also occur. Now next is a osmotic diuretic, which the example is mannitol, urea and glycerol. So mannitol is a pharmacologically inert substance. The meaning of pharmacological inert substance, that means this mannitol does not has any particular pharmacological action. When given IV, orally it is not absorbed. That's why by intravenous route only we give mannitol. Get filtered by glomerulus but not reabsorbed. It causes water to retain in the proximal tubule and descending limb of loop of Henle by osmotic effect, resulting in water diuresis. So basically, or we can there is also some loss of sodium, but ultimately this osmotic diuretic finally it will act by the process or by the effect of osmotic effect. Adverse effects are dehydration, ECF volume expansion, headache and allergic reaction. Now the last drug is methylxanthine. The example is theophylline. So methylxanthine like theophylline have a mild diuretic effect, as we are all aware of that theophylline it is present in the tea. That's why whenever we take excess consumption of tea, the diuresis or flow of or excretion of urine is also increases. So this is all about the diuretics. Thank you.